We conducted a retrospective tri-site Mayo Clinic study investigating the safety and efficacy of CD19 targeted CAR T-cell therapy in patients with non-Hodgkin lymphoma who also had a pre-existing autoimmune condition. We were able to identify 235 patients who received a commercial CD19 targeted product at one of our centers, of whom about 11% had a pre-existing autoimmune condition. We reviewed autoimmune conditions including SLE, inflammatory bowel disease, hypothyroidism, rheumatoid arthritis, among others. The most common autoimmune condition in our population was overwhelmingly hypothyroidism, and the other autoimmune conditions were represented in the single digits, including things like SLE, rheumatoid arthritis, etc. We then looked at these patients' responses as well as toxicities, including CRS and ICANS, and we found broadly no difference in the safety and the efficacy of CAR T-cell therapy in this population. One caveat that I would say is that, the most common being hypothyroidism, it does limit our study. We don't really have good enough numbers to assess the safety and efficacy in patients who have more significant autoimmune conditions like rheumatoid arthritis or SLE. So this should be considered in future studies. There is currently an increased interest in utilizing CD19 targeted CAR T-cell therapy for SLE, and so this issue will most likely be important in the future. We also don't have great data on the longitudinal outcomes related to their autoimmune condition, whether or not they needed or had any modification of their DMARDs. We don't have that data right now, but this is something of interest to us as well.